Hi, everybody.
Hello.
It is just after 2 o'clock. Thanks for joining. I know that some of you had questions related to the testing requirement and how schools are implementing. And I would just start by recognizing that we've had this information for less than a week and have gotten new information literally every day this week. And are doing the best we can as school districts to put plans in place to be able to start this next week. And what I wanted to do is just open it up for questions, because I'm not exactly sure, how much detail or what people are looking for. But I also would just say, I know that the implementation at a school level is going to probably look pretty different from district to district and possibly even from school to school. So I would just kind of put that out there. I want to make sure that I'm not speaking for everybody across the county when I say something or when I describe something. I can only speak to sort of what we've been a part of here in Greece and some of our preliminary conversations and talk and planning. So with that said, I guess I would just open it up for some questions.
Kathy, this is Berkeley Breen at News 10 NBC. I don't mind if I go first here?
No.
Do you think that this testing regimen is going to help schools stay open to the extent that they are?
So, I think some of the thinking behind the testing is obviously just increasing testing and increasing negative results is going to help bring down our percentage as a county and allow us to stay open. So I think that is part of the strategy. And I want our kids in school. I will say, and I know I speak for us as superintendents when I say we need our kids in person. It makes a difference for them. So we're trying really hard to do whatever we can to comply in hopes that that will help numbers in the county and help us to be able to remain open.
And then maybe just a quick follow and then I'm done. How are you going to select your students? How are you going to do that?
So we had sent out a letter with a description of how we understood the requirements in terms of testing. So that went out to our families earlier this week. Within that, there was a consent form where parents have to positively confirm or consent that they're allowing their child to be tested. So when we look to figure out, so when we were looking into next week, we're not going to actually start our formal testing with kids until the end of the week. We'll look at our bucket of positive, the families who've confirmed or consented, and we'll determine by school sort of within that list, because not only are we looking at that list, we're looking at what cohort they're in, because we have a hybrid model, so they're not here every day. And then pulling from that list what we can. Now we're looking at, to get 20% of our kids and staff, we're looking at needing 1,800 people, which is right around what we have in terms of consent right now. So it's looking like if people consented, we'll try to put them on a schedule for next week on Thursday and Friday, be able to pull them.
Hi there, it's Lowell here from Spectrum News. And I know you were saying you're looking to get that 20%. What about the parents that opt out and don't want their child to get tested? How do you overcome that hurdle as you go into the next week of trying to pick a
right? Yeah, so we're not forcing people. I think that's the piece here. We want to make sure families are comfortable and they don't feel forced into testing in school if they're not comfortable with that. I do feel like once we get going next week, if we're able to get going and kids experience it, families experience it, I have a feeling more people will consent because it's not invasive. So this is I have a sample test here. I'm not going to demonstrate it because I'm not sticking it up my nose right now, but it's a swab. We are going to have a video that we share, and I know Dr. Mendoza has done it a few times live for people. But I think once kids do it and see that it's not a big deal, particularly our older kids who can self-administer, it's really just going up and trying to get some moisture from the bottom part of your nose, essentially, to be able to put on the swab. Ultimately, though, families can remain opted out. Families could also do testing outside using outside labs and share their results with us. That'll help us to reach our 20%. And then we're also looking at options in terms of, so we just talked earlier today in a meeting around having some options where we might do some after school hours where if a family really wants to be there together, they can bring their child in maybe on a weekend or at off hours and sort of be there with the child when they get the testing done. So there's a lot of different ways that I think schools are trying to figure out how to make this work, but also to build trust with families so they feel more comfortable about the process and allowing their child to be tested on site.
And one quick follow-up, will this apply to students that are taking part in hybrid or virtual learning, I should say?
No, it's not for any of the students who are deemed that are completely remote are not included in our percentage.
Kathleen, how much of an effect would you think it would be if the county moved up to orange from yellow?
So if we move to orange or red, the way I understand it is that we need to take a bit of a pause. So the way I read that is at least 4 days that we would need to shift to a fully remote. And then in order to bring the kids back in an orange or a red state, we would need to have anybody who comes on site to have been tested. So 100% of the people coming back on site would need to be tested and be negative. So that is a huge lift. So to me, the yellow sort of marcation and requirements are significant, but it's 20%. And I really feel like we can manage this. I don't know that we're going to be able to manage and keep getting new 20% because I don't know that we're going to have holistically a community that completely consents. Of course, that won't happen. To move to an orange or red is really significantly different and like really unwieldy when you think about the ability to implement and get everybody tested. So that's adults and students. So everybody agreeing, everybody would need to be negative. And then it would basically bump into 25% each week would need to be tested. So that really wouldn't be the problem. It would be just that initial shift from, having everybody out for 4 days to then getting everybody 100% tested and back in school. And that honestly, like that sort of is mind blowing in terms of like trying to imagine how we would actually manage that.
Concerned about that? It seems like that's the direction we're headed.
Yeah, I'm very concerned about that. I'm very concerned about that. Because truly, when you think about the lift, and here's what I would say, and this is not to sound whiny, but I said this in the last time that we talked. If we go to an orange or a red, so even now in the yellow, here we have schools that are really shouldering the brunt of this. So many places are going on, most businesses are going on and functioning like normal. Most families and most people are socializing and doing things as normal as we sit in the yellow. Everything has changed for us over the last week as we've known this. We have people who've worked over 80 hours this week trying to figure out a testing protocol and make this work. We're going to blow up schools in terms of their normal procedures to get testing in place. And we can do that for 20% within this yellow. If we go to an orange or a red, I struggle with, again, taking on more of the burden from the community to try to get kids back to school when the community necessarily hasn't brought that rate down. So I think that's going to be a struggle. That's a struggle in terms of whose ownership is it? And is it too much for schools to manage at that point if we go into an orange or a red state?
Kind of going off of that, since we haven't seen a lot of spread in schools, what, from your conversations with the state or Dr. Mendoza, what's the benefit of testing kids in large groups when they're not the ones we're seeing spreading it or being the most at risk?
Yeah, I think it's a way, to initially get a gauge on like a sampling, so to speak. And I think that we're expecting it to be lower. And I think, quite frankly, it's a way to help lower the rate in a community. But I also think you could do that in other groups too. I think when we're doing that in schools, could that be done in other public places? If we're interested in increasing the amount of testing to help get a better sense of the sampling in terms of really where are we, then I think we need to consider not just schools and really consider other places as well. To that point. So the question is sort of leading to why just in schools, which makes sense and is a question that we've asked as well. And I don't think that people are opposed necessarily. I just don't know that we've gotten there in terms of where and when and how would that look within the community.
Yeah, I particularly brought it up seeing a post from the Webster superintendent on their website, kind of explaining it to families as like a math equation. The more people that are tested brings down the positivity rate and getting out of the yellow zone. So, I mean, is that your impression as well, that that's the main point of this?
Yeah. Yeah. But, and then I keep coming back to, so I get that. So there's that mathematical piece of it. But I think the bigger thing that we don't want lost is that the idea that we could sort of artificially lower a rate and not change any behavior within our community, and we're going to continue to have problems. So I think it's important to be sort of a little bit more cerebral about this and recognize that while we can bring that down, if we change nothing in terms of behaviors, we're going to continue to rise in this community. And that's not going to last forever, and we're going to continue to spike. So I think it's got to be really thoughtful in that, yes, we might be able to do this in schools, and yes, that might be helpful in terms of lowering the rate or stabilizing us a bit, but we also have to have some really significant input and commitment from community members around, like, what are we going to do differently? Which in this case, the majority of the conversations that we have really pointed towards small gatherings. And it really, we've heard a lot about the 20 to 30-year-olds, but there's a lot of us. There's a lot of us in our 40s and our 50s who are gathering on weekends to watch Bills games, getting together for family dinners, doing things that we weren't doing during the shutdown that we all of us have loosened. And do we need to consider our own behaviors? So maybe at our family dinners, we need to wear masks. We need to consider social distancing. We need to lower our numbers. And those are things I think that we've got to be real vigilant about and explicit about asking people and talking about in our community to be able to get this under control.
One more quick follow-up. Sorry, everyone. So do you feel that this has any benefit to the kids in school, or is this more about lowering the rate, just to clarify?
I don't see this as like this huge benefit to kids. That's just a terrible answer. But if I'm being honest, I don't see this as being this great experience for kids. I don't think it's going to be really negative. I don't see it as harmful. I think for most kids, particularly if they've consented, we're not going to do it if a kid's uncomfortable, even if their parents have consented, if they're not feeling it. I think the idea of recognizing that they're part of if they can understand that bigger community idea and that the testing does matter in terms of gauging the community, but I don't know that most of them would make that link or association really.
Kathy, a lot of good questions already answered here, but I wanted to just bring up a few that stuck out to me today. There's some districts in the yellow zone where only some of the school buildings are in the yellow zone. Can you talk about those? That's sort of a unique challenge and how exactly that works. I'm thinking of Hilton or Churchville Chi-Li, for example.
Yep. That's so there. I swear, everything about this has been challenging, and so that is unique. Hilton, as an example, has one school that sort of sits in Greece, and so Greece is an area where yellow that one school is. So in that case, I know the superintendent has decided. Obviously, they're going to be testing that school. In Churchville, I know that there was some concern because Chi-Li is within the yellow zone and many of the kids cross over in terms of their families. So they, I think, are choosing, and I'm not positive about this, but they may be choosing to test in both places. I think that's unique, and I think it depends on your community. It depends on, there's probably geographic factors. There's in terms of the connection of families, there's a lot of things that I think those superintendents are considering in terms of making those decisions. But it's not super clear cut in terms of what the state has given. So most of what we're working off of we have very little in written guidance that we're going off of. We're most of this we're sort of sorting out as we go with the Department of Health here in Monroe County and using what we do have from the state, which isn't all that perfect.
Kathy, can I just clear one thing up? Is the mandate say testing 20% of students and staff district-wide or per school?
It says school.
Oh, really?
It does say school. I don't know how, so for us in Greece, I think about that, but I'm going to tell you right now, there's no way I'm going to be compliant with that because I'm not going to, when I think about an affirmative consent, get perfect numbers across 18 schools. So the other thing that it says 20% of students and staff. Now it doesn't say, like I look at that my number is just about 1,800. I can, the way I understand it, pull more staff in and count, like I can take 40% staff and use a less number for students. So there's some play with these numbers and the way that we do it. And for example, I'm going to tell you by school, we're not going to be clean by school. I'll be out of compliance, I'm sure, with that, but I'm hoping that we can get to at least the 20% by the district as we go. And I don't know, what happens if I'm not, I said, we're going to do the best we can.
Do you think the governor's office understands that distinction?
I don't know. I can't say that I know, and I know that they've been clear around just do it. I've been clear, even as we've said, we're going to start next week. We're not starting until Wednesday. I've been clear around we're not rushing. This is a complicated process. It's one that requires thinking, planning. Something as simple as, I use the example with our principals today, we need to think about the area where we're doing this. It needs to be a comfortable space. We need to make sure that we've put some things in that space that are going to lower anxiety for kids. Think about, is there a way to provide a sticker or something? Those are things that need to be planned out, as well as sort of the order and how and communication with parents. I'm not going to arbitrarily just start that on Monday because the state has given me this random deadline of I need to start in a week. We're in the business of kids and trust and families. So we're going to build a system that makes sense, that is coherent, that we can communicate well with families. We'll get started, like I said, probably next week. I'm guessing we don't get to 20% perfectly just because we're only going to be testing Wednesday, Thursday, Friday. And then you have weeks like Thanksgiving and other things like that we have questions about. Like I said, there's not really clear written guidance. So I also don't know sort of the, what's the punishment or what's the outcome if I don't do that. I don't know. All I can say is we're going to do the best we can in a responsible way. Next week, we'll be able to tell you more. So next week, we're hoping from our perspective, we're doing some training on Monday and we're connecting back with our schools again. Tuesday, we're going to do a bit of some pilots at 3 places. So we're going to be testing it out in 3 places just to see how things work from a management perspective. And then to be able to sort of make any adjustments before we go through and actually start on a larger scale on Wednesday, Thursday, and Friday. So as we get into next week, we'll understand a little bit more of that.
Thanks, Kathleen.
All right. Thanks, everybody.
Thank you.
Have a good day. Have a good weekend.
You too. You too. Thanks.